I was in medical school, I was taught that prostate cancer is accentuated by testosterone. And the big phrase that they actually teach you, like a mantra, is testosterone is like fuel for the fire when it comes to prostate cancer. And I had another gentleman come in when I had my own practice. He had some indicators that he may have prostate cancer. So I told him, I said, look, I need to send you to a specialist. He clearly had mild prostate cancer. And I said, unfortunately, you're not a candidate for testosterone therapy. That's what I believed at the time. Welcome to Second Opinion with Dr. Jesse Haggard. I'm Dr. Haggard. I'm with my great friend, Virgil. And we are here to help change the world, no less, with lots of various topics that people just don't know over the years that I didn't learn in medical school, but found to be super effective, super safe. So in early 2000s, I was prescribing testosterone. I was one of the first doctors in my area to do it. And after a few years, I was being a bit harassed by the DEA on why I prescribe testosterone so much. And I said, well, I specialize, and if I prescribed cholesterol medication excessively, no one would care. And it turned into a whole fiasco. And this is what we are here to talk about, as well as trying to educate people on the benefits, the safety. And there's just so much misinformation on testosterone, as well as now, 20 years later, many medications, many treatments, many diagnostic procedures that finally, Virgil's talked me into doing this podcast and really making a difference. Because my whole thing in business is anytime that I'm repeating myself over and over and over, it's time to automate. So I agreed to doing a video series with you so that we can educate not just the general public, but healthcare practitioners as well, because these are problems that affect millions of people every day. So
long story short, he did studies that basically worked, and now he got in trouble for them. And then the long story short, now they did the studies that he already did and made an assumption, and now it's okay because Harvard decided to do it.
So when I was an intern in 2002, I had a doctor that was my supervising doctor and has interns work in a private practice. And you have multiple practices you go to and you visit, and you have different types. And this was just a primary care practice. And this was an older gentleman that I worked for, and he was in his, I'd say, mid-60s. And I had a patient that I went to go take the intake. I'm interviewing the patient. We're discussing his issues of the day and why he's there to see the doctor. And he told me this funny story, actually. He told me the story of how the doctor I was working for, and this was also an older gentleman, he was also in his 60s. And he was recently widowed, but he had met a girl that would come over and visit him a couple times a month.
You know what that means.
And so the good doctor prescribed him Viagra. So he was taking Viagra, and he said the results were really good. And he's like, it worked really good. But then there was one night where he was like timing it right. He's like timed it with dinner and everything. And then he kind of figured it out. It took like an hour to kick in. So he would take it like when she was on the way. So she's on the way, and then he takes the Viagra. And then something happened. She had a family emergency, had to turn around and go the other way.
Oh, that sucks, bro.
So he said, so the Viagra works really good, but, you know, is there another way to do this? Because when she didn't show up, I had all night to think about it.
His left or right hand was his best hand. I bet that forearm was huge. Just saying.
So I said, yeah, you know, let me go talk to the doctor and see what we can come up with. So I go report the story to the doctor and said, so this patient, you know, was looking for something else besides Viagra, and he says, well, we could do Levitra, we can do some of the other ones, and or Cialis maybe. And I said, well, why not check his testosterone levels? So, you know, I'm not even done with medical school. I'm still in medical school, but at this point, I had learned about endocrinology and that testosterone was key for sex drive and also erectile function, as well as energy, fatigue, motivation. It does tons of things for both men and women. So I talked to the doctor and said, what about checking his testosterone? And he flipped out. He said, why would we check his testosterone? And I said, all those reasons. And he said, what are you going to do if it's low? Give him steroids? And I said, well, yeah, testosterone is a steroid, but it's a naturally occurring substance in the human body. It's what makes us men. It's what makes us have all these other features, makes women have a lot of other things healthy in their lives. But in this realm, we're going to focus on men. And he just said, that I can't believe you're talking about prescribing him steroids. In the older doctors' generations, it's taboo. Like, you just don't do it. You just don't do it. Like, I even brought up, what if he's missing the testicle? What if he's... It didn't even matter with this doctor, but the doctor wanted to prove me wrong. So he says, oh, okay, let's check his testosterone. Let's just see what happens. So we checked this guy's testosterone. It was low. And I say low, meaning it was beneath the actual valid reference range that the lab gives you.
What's that level?
They're all different. Each lab has their own reference range because each lab has to validate their way that they actually do the test. And they just range, whether they report picograms, nanograms, whatever. But on average, I'd say 300 to 1,000 is what you typically see on a blood test when you're talking about total testosterone. Right. There's different ways to measure testosterone. We're going to get into all that. But for the basic, is your testosterone low? It was low. So he comes back and I say, hey, you know, your testosterone was low. Here are the benefits. Here are the risks. And would you like to try it? And he wanted to try it. So we gave him testosterone. And then after a few weeks, he came back. We did repeat testing to make sure that he wasn't aromatizing to estrogen, DHT, conversion, or any of that stuff. And he was doing really well. He already reported that a lot of his symptoms, especially with sexual drive, sexual function, had all improved in a matter of 4 weeks. He said he felt like he was in his 40s or 50s again. I mean, for a 65-year-old man to say that, I was impressed. And as an intern, I had never dealt with anybody with testosterone. That was my first experience giving testosterone to a patient. And it was all positive. So I followed the guy. I was only there for 6 months, and he did great. And afterward, I said, well, you know, when something works in life, you just keep doing it.
Yeah.
So
makes sense.
I kept giving it, you know, I kept recommending to patients, especially, I mean, at the time, all these medications like Viagra, Levitra, these were huge. Like, patients were coming in requesting it. Like, oh, I saw this commercial. I want this. I'm like, well, have you ever considered testosterone? It's not, and what's great about these things is you can combine all that stuff with testosterone. Because you already have testosterone in your body. All we're doing is we're getting your levels back to a healthy range. When we start looking at the benefits of testosterone, there's a questionnaire. It's called the ADAM questionnaire. It's a very validated questionnaire. It's a 10-question questionnaire. And it has stuff like, you know, it talks about sex drive, erectile function, but it also talks about energy, height loss, overall muscle repair and fatigue, and just feeling good. And it's so funny that such a basic, natural medicine can have so much stigma tied to it. So when I started prescribing this more and more, and personally seeing the results as a physician in practice, I started doing it widespread, and the patients, they would say, oh, I recommended testosterone because you gave it to me. I'm like, you know, and I heard a friend, they, you know, described similar symptoms. So
it's like kind of a referral basis. Like, you did it to one, and then he said something, and then they'd all spread out.
So
How long ago?
This was in 2003.
Wasn't this during the, like, Jose Canseco era?
Very close. So from 2003 to 2005, my practice spread like wildfire because I took the time to really research testosterone, and there are nuances to testosterone that most people don't know about. Again, I kind of hinted, you can convert it to other hormones like estrogen and DHT, dihydrotestosterone. So when you give testosterone, and we're going to talk about the best types, the different routes of administration and so forth, but when you give it and you start to see the results that I see, in my world as a young physician, testosterone therapy was only second to antibiotics as far as changing people's lives. Okay. Like, it absolutely changed people's lives. I had tons of wives and partners come in and actually come to the doctor's visit with the men, thanking me for actually checking the levels. They had been to other doctors, were prescribed antidepressants, anti-anxiety medications.
Just to sell. That's what the medical system does, is they want to sell you everything to make that money, even if it doesn't help, right?
Well, it's a different paradigm. We have doctors that are trained in how to manage symptoms, but I was conventionally trained as a naturopathic medical doctor, which we focus on the cause of disease. So naturo, everybody says, oh, nature, natural. So nature is Latin for the cause of, or the nature of. Pathos is Greek for disease. So as naturopaths, we actually focus on the cause of disease. And how can you have somebody come in and say, I'm depressed, I can't get off the couch, I have no energy, I can't have an erection, I don't have any sex drive, and not think testosterone?
Well, can I ask you, okay, so we're hearing all the glorified things about testosterone, like it's amazing, it's this, it's that. There's got to be some kind of a side effect. Like seriously, what is it?
The biggest concern that people have about starting testosterone therapy is really prostate cancer. And it even got, in the most recent decade, it got deemed negatively for cardiovascular disease and heart disease. And it's a crazy story about how politics are more important than science.
What about health? Politics are more important than health?
Yeah, according to the FDA.
Yeah, and that's what we're going to go into. Full details of certain situations in certain times.
So when I was in medical school, I was taught that prostate cancer is accentuated by testosterone. And the big phrase that they actually teach you, like a mantra, is testosterone is like fuel for the fire when it comes to prostate cancer. And I had another gentleman come in when I had my own practice after I graduated, and I had been seeing, at that point, hundreds of men for testosterone therapy. And I had a guy that came in, and he was in his I think he was around like later 60s or so, and he said, hey, look, one of my friends referred me here and said that he had great benefits with testosterone therapy that you provided him. And, he told me what the benefits that he experienced were, and he was very interested in trying it out, see if, he could do it. I said, sure. I said, what kind of things were you looking for? And he talked about all the things we already just talked about. And he said, I said, well, let's see if you're a candidate. So after we had talked about the symptoms and signs that he was hoping to look for, we ran blood tests. And when the blood test came back, he had some indicators that he may have prostate cancer. So I told him, I said, look, I need to send you to a specialist, a urologist that specializes in prostate cancer, to see if you have prostate cancer, to see if this is something that would be good or not good for you.
So hold on, let me pause right there. So if he had prostate cancer, then you couldn't give him testosterone because clearly you'll get prostate cancer even worse with testosterone, right?
That's what I believed at the time. That's what I was taught in medical school.
So no?
So when he came back from the specialist, he came back with the report and all the lab results and everything, and they had done some biopsies, and he clearly had mild prostate cancer. And I said, unfortunately, you're not a candidate for testosterone therapy, and, unfortunately, you should probably go back to him and deal with this prostate cancer on whatever he recommends, because I was not a doctor at the time that focused on cancer. And he said, well, I had another friend that had state-of-the-art robotic surgery, and then they also did radioactive little chips that they put in.
So radiation.
So it was a combination of robotic surgery and then radioactive chips that they put in the prostate to kill the cancer. And he said now he wears a diaper and he can't have intercourse.
So clearly that didn't work.
Well, did it?
Robots in your butthole does not sound great to me. I'm sorry. Not even as a play toy, okay? Gross.
Well,
I would say absolutely not.
Well, it's robots with a bunch of needles too.
Yeah.
So he said, well, I had one friend that tried the testosterone and worked out really well for him. I had the other friend that had the opposite results when he went with the conventional recommendation of surgery and chemotherapy. Or, I'm sorry, radiation therapy. Not chemotherapy, radiation therapy. And he said, I think I'll take my chances with the cancer, and I'd like to try the testosterone. And at this point, I'm sweating bullets as a young doctor.
Yeah.
And so I call my attorney and I said, look, I appreciate that this patient I'm calling you about wants to be proactive about his own health. And he's done some research. I told him the risks and benefits, and he says he'd like to take the thing that I'm not recommending. And I said, but I do think it would improve his outcome in a lot of ways. And so I said, but I'm worried about my liability.
Yeah, you're going to get your ass busted.
So he said, well, let me form you ironclad consent form. So he took a few days to give me this consent form that was like 40 pages long. No kidding. Like, it had all kinds of verbiage in it.
So like his lawyer and your lawyer came together and made it?
No, my lawyer just drafted this up to protect me.
To save
like,
your ass, yeah.
And hey, your family can't sue my family, even like between us. Like, you know, for me,
I still talk to this guy?
I don't.
Damn.
He passed away.
Oh, not of prostate cancer, right?
He did not die of prostate cancer.
Well, then you did your job.
So he came in, and we started the testosterone therapy. And I said, look, most patients, I monitor at first, the first month, and then after that, usually every 3 months, and make sure everything's well. I said, for you, I said, I'm really worried about this, but I want to try it with you. And I said, I need to follow up with you and blood work and all kinds of stuff every month. So we're gonna check you every month and see how everything goes. So after the first month or two, he had the typical results of what you see with testosterone replacement therapy. He had better sex drive, better erections, better energy, better recovery. He was able to even be more motivated. And then, you know, a lot of things that you don't hear about testosterone, and on top of this, is how it affects diabetes, especially type 2 diabetes. So when you have type 2 diabetes, you have elevated blood sugars. And when you have low testosterone and you supplement testosterone, your muscles, they get better. They get better at absorbing sugar out of your blood, and they actually improve diabetic outcomes.
Do you have cravings though? Does it because you know, some people that are diabetic, it's because they have cravings for sugar, they have crazy cravings for French fries. Like, that's why they're obese, clearly.
There's definitely some factors in there because, again, we talked about how testosterone changes motivation. I mean, I noticed the biggest thing and I ended up specializing in diabetes, not because I love diabetes, that's just what kept walking in the door. I mean, we were in a diabetes pandemic at the time.
Yeah, I was going to say, that would be your gold mine as a doctor, clearly, because everyone is, well, nowadays, especially here in America, are obese, heavy set, like fast food, and the food here is terrible in the fast food thing, so that's probably a moneymaker, right?
Well, another thing, too, is most of my diabetic patients, especially type 2, they just didn't do much activity. I mean, and then so we go back to like the cause. Like, okay, what's the real cause here? Well, they're not moving. That's part of the cause. They're not doing activity. I mean, my average diabetic male patient would say, man, come 3 o'clock, I'm on the couch. I'm dead tired for the rest of the day.
Well, what's the difference between, what's the difference between testosterone and a pre-workout? Because let me tell you something, I'm tired, and once I pop in a pre-workout, I don't need testosterone.
Yeah, well, again, testosterone is your ability to just have your general drive, especially with sex drive. I mean,
okay.
That changes a lot of things. And on top of that, just your general desire to be active, to have, no kidding, like I had so many partners come in and say, oh my gosh, you changed my husband's life, my boyfriend's life. Like, he's doing stuff again. He started,
getting off the couch.
He started golfing again, or he started, doing whatever. He started having an actual hobby. And it's crazy how much hormones actually change the way people think.
Okay, so let's cut to the chase. Okay, we hear all the good. There's got to be some kind of bad with it. Like, what's the outcome of the bad side? Okay, if I have one, I know a side effect, actually. When women take it, why does it sound like their balls hang lower than me?
So, with my patient, though, that we had on testosterone, he had documented mild prostate cancer. After 10 months, he went back for a visit, and all the monitoring I did with him only improved. Everything improved, even his PSA levels, which at the time I thought was a cancer marker. It's not. A little hint on that.
Oh, time out. I'm interrupting you. So you're trying to tell me that testosterone cured his cancer without radiation?
It didn't cure his cancer, but his cancer
slowed it down.
His cancer was undetectable after 10 months.
So what stage was he in when he had prostate cancer?
That's complicated as far as like the Gleason staging, and that's, I think, a little more beyond this video.
Okay.
But for the most part...
And he had no radiation whatsoever?
He had no chemotherapy, no radiation.
That's freaking rad. Can someone just do it so they don't get it and just take it so there's no prostate that even starts?
Well, after he came in, and he was having all the benefits, none of the side effects, and even to the point where his prostate cancer was undetectable...
That's sick.
Then I started to ask myself, what do I really know about this? I mean, I was taught in school this, but who taught my school that? So I started to go to a deep dive on why this was happening. And it all came to a 1941 experiment, and they had 3 guys in this experiment who had prostate cancer. Mm-hmm. At the time, they actually surgically castrated them. So they removed their testicles. And after they removed their testicles, they reported after a year that all 3 of their prostates shrunk.
From removing their testicles?
Yes. which isn't unheard of because your testicles, the testosterone makes your prostate tissue healthy. But it's similar to like estrogen and breasts. That hormone is the secondary sexual characteristic generator, right?
So, okay, I just want to get this straight. So you're saying they had to remove their testicles so they don't get prostate cancer?
No, they already had their prostate cancer. They already had prostate cancer.
And then the testicles removed helped it not get worse.
It seemed to shrink the size of their prostate, which they assume was shrinking the cancer.
Okay, so let's be honest.
And this is the 1940s. So just to remind you, like, there's no CT scan, there's no MRI.
Yeah.
This is a rectal exam. This is a finger, you know where, and it's trying to feel a walnut-sized gland through a colon. Not the most accurate test. Like, it gives you a generalized assumption of what's going on. So as I looked this up, this experiment's very interesting. There were 3 patients originally in the experiment, and the authors only reported the results of 2 of the patients. And here's what they did. Of the 3 patients, after they removed their testicles, they gave them testosterone. And then after a year of testosterone therapy, they reported that the digital rectal exam, they felt that the prostate had gotten bigger. And so they concluded testosterone increases prostate cancer.
So those poor guys got their nuts cut off and they still had it worse.
Well, then they removed the testosterone therapy. But the testosterone supposedly made it bigger. So I'm going back to this, and I see all these studies since the 40s, so at the time, 60 plus years of studies, that they all cite this one experiment as the reason that testosterone causes prostate cancer to get worse.
So basically, do they still think that in nowadays?
A lot of doctors do. I still believe most medical schools teach this.
Wow, that's insane.
Yeah, this is my revelation 20 years ago.
So I bet you're pissed.
Well, it's changed a lot of people's lives, I think, for the negative, including my own, because...
And many people died, clearly.
Well, they definitely didn't have the quality of life they could have had. But here's where I started to take a common sense approach to this. Who gets prostate cancer? Is it young guys in their 20s with the highest levels they'll ever have in their lives of testosterone? Or is it guys in their 60 to 80 range with low levels? I ended up giving quite a few patients testosterone with prostate cancer. And unanimously, they had better outcomes than the patients that I saw who had prostate cancer and didn't get testosterone. I kept looking this up thinking, am I the only person who's experiencing this? And at the time, there was a Harvard professor that was reporting case studies, Dr. Abraham Morgentaler, of the same thing, that he experienced a few patients in the beginning who he had given testosterone therapy to, who had gotten better with prostate cancer.
Have you met this guy?
I have not met him, but I had regular email exchange with him in the early 2000s. Abraham Morgentaler is the most renowned doctor in academia when it comes to prostate cancer and actual research studies that he has either been in charge of or personally conducted. And he has really challenged this myth that testosterone therapy causes prostate cancer to get worse, whether it increases the risk for development in patients that don't have, or people that don't have prostate cancer, or people that already have prostate cancer, if it's going to make it worse. And he has systematically taken every major category of prostate cancer, mild prostate cancer, moderate prostate cancer, severe prostate cancer, whether it was benign or it had already metastasized and spread. And he has definitively taken patients and using the best science we have available, which is randomized controlled trials, not observational studies, but randomized controlled trials. In 2025, the package insert on testosterone has a section of contraindications, and it reads contraindications, prostate cancer, cardiovascular disease, or heart disease. So even though allegedly there's no science except for a three-person study in 1941 that shows only 2 people had an increase in their prostate gland size after being medically castrated. Since then, they've had thousands of men receiving testosterone with prostate cancer in the best types of clinical trials possible, which is a randomized clinical trial, and all the evidence shows contrary. It's still on the package insert. And what's wild is even cardiovascular disease is on the package insert, or heart disease. And there was a study, one study, that came out after a slew of studies showing that testosterone improves heart health and cardiovascular health. And then there was one study in the Journal of the American Medical Association in the early, 2013, 14-ish is where it was published. There were some commentaries back and forth, and they showed that cardiovascular disease got worse with testosterone therapy in men that had low testosterone levels. However, JAMA messed up the statistics. And Dr.
What is JAMA? What is JAMA?
JAMA is the Journal of the American Medical Association. So it's a prestigious journal. Journals are kind of ranked that some are better than others.
Okay.
JAMA is a good one. However, they had messed up their statistics. And Dr. Abraham Morgenthaler also showed the editors missed checking the actual statistics, and rather than saying that the testosterone therapy had a negative effect on their cardiovascular health, it actually had a positive effect. And there's lots of problems with this particular study, including that part of the population that was supposedly male actually were female that they collected. I mean, there's some major, gross, negligible problems with these studies.
So hold on. I'm going to interrupt real quick. So you're telling me that male or female, it's okay, or do they have different effects, or is it the same thing?
Oh no,
with
this
prostate
particular
cancer?
study was specifically designed for males,
And
but
females.
somehow females got mixed into the results.
And it still
was
worked the
just
same?
a grossly negligible study. I mean, it was just poorly done, unbelievable. They made a retraction, but before they made the retraction, when they first came out and said, oh, testosterone causes cardiovascular disease to get worse, it's bad for your heart, this was worldwide news.
And how long ago was this? What year?
About 2014.
Oh, wow, okay.
And then he pointed out, along with some other colleagues, that the study was completely wrong. But by then, the FDA got a hold of it and put it on the package insert. And now, 10 years later plus, it's still on the package insert. So the FDA is interesting that it's so quick to say, oh, this is bad, and then the research and the data say otherwise. Somehow it's not important. So if you're a prescriber and you're looking at the package insert, oh my gosh, you have low sex drive. You have difficulty with erections. You have low energy. You're getting shorter. Overall quality of life is getting bad. You might be at higher risk for prostate cancer because your testosterone is protective for your prostate. But man, you might die of a heart attack. So why would I give you that? Because then none of that matters. You might get prostate cancer because what I'm doing. All not true. So the data supports that's most likely not accurate. And then that's possibly a good source of misinformation, why a lot of doctors don't offer testosterone therapy to get at the cause of these problems of aging and other disease processes that can cause their testosterone levels to go low, and then they start having these other problems.
So are doctors pretty much scared to prescribe this because of them getting in trouble? Because that's what it's kind of sounding like to me.
They are most likely...
Or they think that the studies that you know versus what they think they know, that's why they don't. Allegedly.
There was a movement early in 2000, and again, that's when I started practicing medicine, and I was a rare practitioner that was prescribing testosterone because I was open-minded to it, and I wasn't scared of all these claims of negativity. But then there was a major turning point with politics, and that's when Jose Canseco, in 2005, wrote a book called Juiced that talked about the prevalence of steroids, meaning testosterone, because there's different kinds of steroids, anabolic steroids, corticosteroids, but specifically anabolic steroids. Testosterone, most likely, the more common one. There's synthetic, natural versions, and so forth. But that there was steroids rampant in the locker rooms in baseball. And this got to the point and escalated. Jose Canseco was doing interviews at the White House. And then all of a sudden...
He got busted, didn't he? He got really in trouble because they thought he was doing steroids. I think a whole bunch of those baseball players got busted, not just Jose Canseco.
Well, he was the one who actually came out and said, this is a problem.
Yeah.
And I commend him for that. Great. He stood up and said, you know what, I think this is a problem. It's not just my problem. There's other people doing this. And the response of Congress was interesting. They basically used this as a reason to go after all the doctors that were prescribing testosterone because there was an unlevel playing field in sports, specifically baseball.
So did they basically say they were cheating because they were taking testosterone?
Correct. And regardless of other conditions. So I actually treated many athletes, not necessarily professional, some professional, but many athletes or men that had darn good reasons for taking testosterone. I mean, they had super low levels, either had trauma, like I had a guy who rode dirt bikes for a living, and he crashed and he ruptured one of his testicles, and he did not make normal levels of testosterone afterward.
Now you need it.
And now he needed it to be on the same level playing field.
So
how about the opposite twist on that? Like, what happens when you have a condition that you're not making as normal levels of testosterone as all your peers? I'm talking about this idea that politics got involved in medicine, saying that if you do testosterone, then you're cheating. But they're not taking the context of the individual in perspective. If you have low levels of testosterone, for whatever reason, aren't you at a disadvantage if testosterone is that important and supposedly taking testosterone, if you don't even need it, gives you an advantage?
Does it help women as well as men?
Oh, absolutely. You have the German Olympic swimming team that all of a sudden showed up and looked like a bunch of guys.
So why does it have
they all
a
got
different
gold
effect?
medals and...
But why does it have a different effect with women like that than men? How come men don't grow facial hair, or we lose our hair and they grow hair?
No, testosterone helps improve secondary facial hair. So supposedly, testosterone can improve your performance in activities and sports. So if you have low testosterone, how is that not a level playing field by supplementing testosterone in those individuals to where they're more like their average peers?
If testosterone is all good and bad, and we were talking about side effects, what's in it that's so bad? I don't understand.
Well, the type of route of administration can make a big difference. And that means how you take it. So you can take testosterone lots of ways. You can take it in the pill. You can take it in a lozenge under your tongue. You can take a cream.
A shot.
You can take an injection.
Not that I know. Allegedly.
However, out of all of them, the one that seemed to be the best for my patient population is the injection.
Yeah.
People do really well with injections. There's not a lot of, it didn't go through my skin for whatever reason. And then there's also concerns, especially when guys are around other females, because if they're rubbing it on their skin and they might have a spouse or kids or, that are female, well, they're going to get it too. So that's sometimes a concern. And then on top of it, when you apply it in your skin, it also seems to enhance DHT, which is the conversion that messes with your hair growth or can cause more hair loss.
So shooting it, does it matter where you shoot it?
It's typically intramuscular, and
like your butt.
You can do your buttocks, thigh, or your delt. However, in my experience, the glute is the best way to do it because that's
it doesn't hurt.
The largest muscle.
Yeah.
Especially when you talk about your delta, it's a smaller muscle group. So
that shit will hurt there.
It can. I would say the least comfortable, in my experience, is the thigh.
Oh, really?
Because the thigh is a quadricep. They're small. There's 4 smaller kind of muscle bodies.
The needle's that big, and putting it right there, that'd hurt.
Yes, and so most testosterones are oil-based that are injectable, and the most common carrier for testosterone is cottonseed oil. And this is a story in itself. So if you're going to get testosterone injections, you should not get cottonseed oil. And
what does cottonseed oil do? Why?
So first off, cottonseed oil is a very abnormal substance as far as being in a biological system. There's no animal that eats cottonseed oil. None. And it just happened to be something that we produced a lot of when we made cotton. So humans kind of created cottonseed oil, and then it didn't really have a lot of uses, so then it was really cheap.
Do they still put that in testosterone nowadays?
They use it in testosterone nowadays. So they need an oil to combine with the testosterone because testosterone is a lipid, so it's a fat-based molecule. So you have to put it in a fat in order to have it dissolve and be in solution.
So
or
what can you substitute it out for? If cottonseed oil is so bad, what does cottonseed oil do for your body? Like, what does it do? Why is it so bad?
In the 1980s, they published a trial in Asia. There was 4,000 men involved, and it started from 1972 and then it was finally published in 1980. And they were experimenting with cottonseed oil as a male contraceptive. It was 99% effective. It never went to market because it wreaked havoc on the men's endocrine systems. Some people never recovered. They were actually remained sterile afterward. I mean, most of them, the sterility was reversible. But that's not an uncommon story with contraception. There's many women who have taken contraception and then all of a sudden when they get off after whatever, 5-10 years, they can't get pregnant. So that happened with the men too. But, I mean, from the 1980s until now, I mean, 45 years, and no one brought it to market, and it's 99% effective.
And they're still putting it in it?
And then, ironically, they make testosterone in cottonseed oil, and that's what's commercially available across the board in the United States.
What does it do to affect men?
It reduces your energy levels, your sex drive, all
those 10 steps.
All the things.
So you're taking testosterone and you're still fucking up those 10 steps.
Yes. It makes no sense.
So it's almost like the medicines. They constantly give you medicines that don't cure you, but you still purchase it.
And if you quit taking the cottonseed oil, again, a lot of this is reversible. But if you're on testosterone therapy, you're typically on it, for a long time or the rest of your life.
Yeah.
And so you never get a break from it. So all those effects, long term, never been studied. But most likely it's not good.
So tell me, what is a substitute for cottonseed oil? And did you make it to where it was right?
There are other oils that have been shown not to be problematic, such as
allegedly
grapeseed oil and sesame seed oil. When you make testosterone injections, on average, when it's in an oil based, you cook it in order to sterilize it. So you need an oil that can handle a high smoke point. But on average, compounding pharmacies for the last couple decades have been making testosterone in sesame seed or grapeseed oil, and I think they're far superior products, and the data suggests that they're going to give you less side effects than the commercially available cottonseed oil.
Interesting. So the lesson learned today is make sure you look at your ingredients in your testosterone, because if there's cottonseed oil, you're going to get fucked up.
Yeah.
And you're welcome.
And I think, in summary, testosterone is safe and effective for most people that have low testosterone. So the best thing to do to start is take the Adam questionnaire. If you answer yes to number 1 or 7 or 3 of those questions, then it might be worth talking to your practitioner, getting a blood test, and then if you decide to do testosterone, don't worry about the 2 side effects that most doctors are worried about. And if your doctor's worried about that, educate your doctor. Look it up. Show me the data. Where is it specifically showing that testosterone therapy can cause prostate cancer or make it worse if I even had it in the first place? And does it actually worsen cardiovascular outcomes? And it doesn't. And then if you decide that the risk outweigh the benefits, because there are other side effects that we didn't cover, they're not nearly as common or nearly as worrisome for most doctors. And there's other ancillary medications that can offset those side effects, like estrogen blockers and so forth, DHT blockers as well. But if you decide to do the testosterone, I would highly recommend testosterone injections. There are lots of them available.
Do you know any specific names of ones that you would recommend specifically that don't have cottonseed oil in them? Because I'm sure a lot of our audience would really like to know that.
If you decide to proceed with testosterone therapy, request from your physician that you get testosterone cypionate, which is the most common form, in grapeseed oil or sesame seed oil, because they've been used for decades, and we know that those are safe and effective for most people that have low testosterone, that they're trying to improve that. It's on average a once-a-week injection. Your doctor can do a blood test to figure out what dosage you need, or estimate it and then do a follow-up blood test to make sure that the levels are actually where you want them to be in the reference range. And from there, don't worry about all these crazy accusations and side effects. So there's one caveat to this whole episode.
And what is that?
What happens if you have an elevated PSA level?
And that'll be for our next show. Jesse, thank you for coming on. I really greatly appreciate you finally doing what I wanted to talk about for like 20 freaking years.
Follow my podcast on drjessehaggard.com.